My friend has a pony, so I want a unicorn, and I want the new best thing. You can't just take technology for technology's sake. That's where the field is going, so that we can actually build stuff faster than IT, faster than the digital team. When they finally saw it run, the one girl started crying because it was just so impactful. Even in the age of digital, there are people that just are not, for whatever reason, interested in being digital. And we still have to serve them, and we want them to have the same care.
Why do things like midnight mammogram bookings matter?
I'm a Southern Belle. Do you understand what I'm saying here? I'm looking for a dog. We turned it on in the morning, and we waited to see if it was going to be answered. And the reps were sitting there, and they're like, you guys broke it. With AI, you're never done.
Welcome to another episode of CEX Talks. What happens when you blend AI, empathy, and access into one digital strategy? To talk about it, today we have Crystal. She's the Enterprise Chief Digital Transformation Officer at the Medical University of South Carolina, where she leads technology innovation to improve patient care, operations, and research. She's a globally recognized digital leader, named one of the top 100 global chief digital officers in 2024 and 2025, known for people-first innovation and a track record of transforming healthcare through technology. Crystal, welcome to the show.
I'm happy to be here. And congratulations on your award, too. You're in that Chief Digital Officer with me.
No, thank you. Thank you. Yes, we share both 2024 and 2025. Maybe we'll do it next year too.
I never know.
But Crystal, let's start, with your journey first, so that our viewers understand, where you're coming from, what you actually do. Because when I went through your background, it's pretty interesting, from technology into healthcare. So talk to us a bit about that.
Yeah, so I started out as a programmer way back on, COBOL, CICS. And then I grew up, most of the young people won't even know what that is. And then I grew up and became a manager and a business analyst. And I went from both technology, but also from consulting to big business to consulting, because that was an opportunity back then to learn the new great technologies by switching jobs. And so I got an opportunity to learn a lot of different things. And I've been in healthcare, I've been in insurance, I've been in health clubs, manufacturing. So I've seen a lot of different areas and different transformations along the way. I started in healthcare 5 years ago, when I went to North Shore University Health System in Chicago, where I realized that all of the technology that I was learning could be applied to help a mission organization rather than just a for-profit organization. And I worked on a digital app that wrapped around the EHR at that point. I started with a team of 0 and moved up to a team of 10 that were working on that app, plus consultants. I get that opportunity to do it a lot. I've actually gotten to build teams many times, which I really, really enjoy. And then the opportunity to build a team down here in Charleston, South Carolina came up. And so I moved from Chicago to Charleston, and where I now lead a team of 8 for the Medical University of South Carolina. We are a premier health system in the state. We cover all 46 counties. We have 16 hospitals. We're also a university, so we have 6 colleges. So I also get to help in the college area with technology and our research department. About 7.1 total enterprise budget. And we're also one of 2 national recognized telehealth centers in the country, and an NCI designated cancer center.
Wow. That's a lot on your plate. And how does the speed of innovation and digital differs across these 3 different things, right? Telehealth at the forefront of digital. Education, I would rank number 2. And healthcare, because of the regulatory environment, has always been the slowest. So talk to us how you balance these 3 very different businesses, very different environments.
Well, I think, the one thing that I bring is an outside lens into healthcare. I mean, I've seen banking, I've seen insurance, I've seen those things. I've been through those transformations. So I know what's possible and starting to look to go, how can we make things better for a patient, for a provider? Everybody thinks they know healthcare because everyone has a doctor, right? So they know what they like and what they don't like. So they are the worst critics of anything we're doing technology-wise. But you don't want to make it harder on the patients. It should be seamless. You want to make it easier for the doctors, for the nurses for the front desk staff. So, when people say, I just went to a conference and I saw this and it's great. And, and then somebody goes, well, my friend has a pony, so I want a unicorn and I want the new best thing. You can't just take technology for technology's sake in an environment where the margins are super, super thin. They're very regulated, and we're much more conservative in healthcare. So it's not a balance sheet that could get messed up at someone's lives at stake. So you really have to make sure whatever tech you're putting in is the right technology and makes a difference for the people who are using it.
So what was that moment, when you realized that, hey, tech can impact lives?
I honestly think my girls decided to go into nursing. I have 2 daughters, and they both decided they wanted to be nurses. And I know them working with the EHR and how frustrated they were with that, realizing that, I could probably make a difference in that field and affect people like them, like other friends that I have. I work for the American Association of Diabetes Educators, and I had a lot of friends that had diabetes. And so helping those providers find out about those tools that they could use to help their patients became something that I became very passionate about. So, a wide variety of little things, and then the opportunity to be at North Shore and then be here at MUSC, where they're very innovative. They want to add digital to things. They want to be at the forefront of things, and being able to use technology to do that is fantastic.
And is that when, given your consulting background, you realize, okay, hey, let's start with understanding behind the scenes? Because I remember, what you once said, behind the scenes changes how you shape the front line, which I think is very important, for any transformation anywhere.
Yeah, I agree. I think that when you look, sometimes it's not the very first thing you see that really makes a difference. It's, yes, I need to get care, so I need to see a doctor. What is the difficult part of that? Well, making the appointment, getting that scheduled, making sure that any other things that happen in that list of things that you need to do, blood tested or whatever, all happen at the right time, the right place. Being able to schedule it when I want to. I work during the day, so I'm not going to be busy calling a doctor's office to schedule, and most people aren't these days. So trying to figure out what we do next and so on for that. Trying to get that authorization, which can take weeks sometimes. There are ways to add technology to that so that moves faster. And if I fix the authorization and get that in faster, then the patient can get in faster, then they can get taken care of faster. And the doctor's less frustrated because they're waiting for that. There's a whole ripple effect of various things that happen behind the scenes that if we add some technology to it, it can probably make a whole better process.
And then not to mention the overall cost of care. Correct? Because that's the biggest thing in our country today, we are struggling with, and how do we bring that cost of care down?
Right. And that's going to be an ongoing struggle for everyone, right?
Yeah, correct. And then maybe that's what leads us to my next question about Emily. And I was reading about Emily, although I haven't experienced it in real life because I'm not in that hospital system. Maybe I would have otherwise. But talk to us about Emily, the AI voice assistant. How did it come about? When did you think about it? And given all the constraints, how did it actually get into production?
Yeah, so Emily is our voice bot. For our patient access center here in Charleston alone, we have 42 phone lines that go into our patient access center. Well over 100 representatives that answer those calls every day from 9 to 5. And that's very important that they're there that time. We don't have a 24/7 desk. And long wait times. We had 30 open recs that we could not fill just because it's really hard to hire call center people. And so the lines are always busy and they're always answering, and it's very frustrating. And that's not the best patient experience, and certainly not a good experience for our frontline caregivers, in this case on the phone. And so working with the director of the patient access center, we were talking about what can we do that would make it better. And we found an AI solution that can answer the phone and answers it as if you are talking to a person. And she literally answers, "Hi, I'm Emily, your digital assistant. How can I help you? I would like to check on my appointment, please." "Sure, I can help you with that. I see that you have an appointment this time and this time. Which one? The one for next Thursday or the one next week or on the 23rd. And whatever those are, she understands. And then she can say, "Yes, you have one with Dr. Smith at 2:00. Would you want to confirm that? Do you want to cancel it?" We just taught her how to reschedule. So now she can reschedule some appointments. And so goes through that conversation. But not only that, she also understands secondary and third. "Yeah, I'm going to need to know what time that is and where do I park?" And then she can go, "Okay, and when you want to park, you go this way," or whatever. We started it very small with pilot because we weren't sure, that it was really going to work. Obviously, we always start small. 4 lines. We turned it on in the morning, and we waited to see if it was going to be answered. And the reps were sitting there and they're like, you guys broke it. My phone's not ringing. And then we looked and it was like, no, Emily's answering the phone for you. That's why you can breathe. So, it's always first that everybody assumes, oh, the tech's broken, but it didn't. And since then, she's been very successful. She takes care of about 17% of the calls, which if you think that, then that lets our reps, doesn't mean we get rid of 17% of our workforce, but it means that our call wait times have gone down, call abandonment has gone down, patient satisfaction has gone up, the employee satisfaction has gone up, and our employees can now help with a difficult schedule where you're trying to get an MRI, blood test, and everything all in one day, for example, or try to direct you to a doctor that does this or such, whatever. So patients are on a scale of 1 to 5, about a 4.2 of thumbs up. They really like it. We were afraid patients wouldn't like it right away. We do get, I don't know, maybe third or so that just like, let me talk to a person. That's okay. That's fine. But also she answers after hours, and she answers well over 1,000 calls every week after hours, which we were not able to offer 24/7 support before. And we now have her answering in Spanish. So with all of those things, very, very successful. So much so that we decided to move it to revenue cycle. And now she answers questions about billing, because that's a different call center, because it's a different set of things. So she can now tell you how to pay your bill, what your balance is, several other sort of standard prompts, use cases. There, she's even more successful. She's taking about 30% of the calls. So the revenue cycle folks really love it, that because they are able to work on we're not getting rid of anybody, right? We're letting them work on the higher level things that humans really have to do and take some of that burden off their plates. So just one.
And that's, where I would say, I'm quite interested to understand two things.
Mm-hmm.
And then you hit upon them while you were talking about it. One is when you call in, the bot says, hey, this is your digital assistant. Is that your strategy around building your end consumer trust in AI? And what are your thoughts about it? How do you do that? Second, as your reps were waiting, they're like, hey, the tech is broken. And how do you build that trust internally that, hey, it's not to replace you, but it's to augment you? What are the challenges you faced? And what
is really important in these tools so that people understand why. And so we had the team from the very beginning working with us as the vendor started showing us, this is how it's going to work. This is what it's going to be. Let's walk through your phone trees. Let's talk about how you work with it. Let's talk about the wording and how it goes, stuff like that. And to let them know that this is to help them so that they are using that. Very much, it is your assistant. It is taking some work off your plate, but it's not going to replace you because you do things that the bot could never do. And so we never had a concern about that. We did have to show them that it was working. We're like, no, come see on this screen. This is all the calls that she's answering. You can see, and we can look at the conversation all the way through so you can see how she answered. But they also tested it before we ever went live. So they knew exactly. We had the end users actually calling in and testing it so that they could hear how it sounded and what it looked like and things like that. That also helped a lot. So we had that trust factor, and we had the change management all the way through.
And is there any plan now to replicate this on the education side? Because I'm sure on your student helpline.
The colleges are very interested, especially because we have mostly adult learners. And so, again, they work all the time as well. So if they want to find out about a program, or if they have questions about the stuff that they're doing, being able to get something after hours, even if it's just a message to the college to go, hey, I'm looking for how I find a syllabus or how I found this grade or whatever that might be, that they could ask after hours and get some of those answers right away. So yeah, definitely have talked to some of the college deans about that.
And I know you've mentioned that, now you almost get like 1,000 calls a week, which is after hours. Talk to me a bit about that. Why do things like midnight mammogram bookings matter?
Oh, so the mammogram story is a really good one because we do outreaches to patients as well. We do that through text. We started reaching out to patients for pre-registration. If you had an appointment with one of our doctors 3 days before, we send you a text saying, you have an appointment with Dr. Smith. Would you like to confirm or cancel? And then fill out all your demographic information. Grab your driver's license, take a picture of it, give me your insurance stuff. And then you're pre-registered so that you don't have to, when you get to the clinic, get that clipboard, which we've all gotten, right? We're killing the clipboard. It's all done on your phone. And so that became very successful. People really liked doing that. About 50% of the people that we send those to actually fill it out all before they come to the office. That also is in English and in Spanish, so people really like that. And then it saves 3 to 5 minutes for the front desk person. So again, we're not replacing the front desk person, Because it's not like, okay, well, you save 5 hours this week because everybody pre-registered, so you get off on Friday. Because we still need her on Friday because we still have patients on Friday, right? So, but it does let her book a referral, book their next appointment, things like that at the front desk. But because the texting campaign went so well, we started using AI to scrape the charts to see who didn't have a mammogram. This was right after COVID. And so like a lot of women didn't get their mammograms. And so we were tracing, anybody that's got over a year, we sent a text to them with a schedule right there that you could book right on the phone. Like, would you like to have your mammogram? And then here's available slots, and you could book those. So we turned down at 5:00. We sent a bunch, and then we like staged it out over weeks. That first night, we had like 150 women schedule their mammograms without ever talking to a person. And that happened after hours. So that means they didn't have to do it. They had kids during the day. They had to pick up from soccer practice. They were working. They were making dinner. They got to do something at the time that they wanted to do it. And they didn't have to call. It was very convenient for them. And the convenience factor, meeting me where I am when I want to interact with the health system, is super important. We've had over 2,000 mammograms scheduled. About 200 of them came back with adverse findings. So those women, if they hadn't gone in, maybe wouldn't know that they needed to come back to be rechecked or get some sort of treatment. So in a way, technology is really is saving lives, which one of the things I'm most proud of since I've been here this past 3 years. So, but that was successful. So now we're doing it for all kinds of care gaps: flu shots, well child visits, hypertension, diabetes, and we're continuing to go on for other screenings, cervical, colon, all those things, so that we can get people in to get the care that they need.
Does that demographic and the interaction patterns go into the decisions you make?
Absolutely. We actually set up a set of personas that would go over both generational as well as, we have a Spanish-speaking persona. We have an older person. We have a person that's living with their daughter, for example. Different personas that we use, and we go, okay, well, how would Sally use the system when we create this system? And what are her motivators? Well, she moved down from Chicago. She has asthma. She doesn't know anybody. How does she find a doctor, for example? And we work through a website where we now have true transparency into our open slots for doctors. So I can search, because maybe I don't know if I have an 8th grade graduation, reading level. I may not know what an ophthalmologist versus an orthopedic is, right? So if I'm looking for at a big medical center, a lot to look through to find something. But if I type in at the tops, I'm searching for a sore throat. What kind of a doctor do I say? I'm searching for knee pain. I can see doctors that only have appointments that are orthopedics, but also that specialize in knees. So I'm not trying to go to a shoulder doc for knee pain because it won't let me schedule it that way. And so very, very important. But also, I prefer a Spanish-speaking doctor. I prefer a doctor that speaks Portuguese to be able to see which doctors are available. I can take a woman doctor instead of a man doctor because I'm not comfortable with men or women or whatever that might be. So doing all those things to meet people where they are, being able to show them that there are appointments in Charleston, if that's where I live. But if I live in rural South Carolina in the upstate, I probably don't necessarily want to come down to Charleston, a 3-hour ride, to see a doctor. I want to find doctors near me. So show me based on my zip code where there are doctors that are close to where I live, and I can get the care there. So, and we truly believe that local care, meeting you where you are when you want to, is super important. So we also in our website show you how you can go to a local urgent orthopedic center if you look for orthopedics, or how you can do virtual visits. And you can get an appointment within 48 hours if you want to schedule an appointment, or we have virtual urgent care so that we can see people how they want to be seen. There are some people that are always going to want to talk to a person, right? And so we have Larry, and Larry is our persona that doesn't take texts, does not like to call the call center. If he does, he asks for a person right away, darn it. He will not pay his bill online. He brings his checkbook and pays it to Sally at the front desk. He will not pre-register. And you know what? That's okay. Because even in the age of digital, there are people that just are not, for whatever reason, interested in being digital. And we still have to serve them, and we want them to have the same care. So we kind of weave, what do we do physically in the physical space with what do we do digitally? And so we call it phygital in our department. So how do we weave the phygital together so that the experience is relatively the same for whatever persona we're working for?
And that is so interesting because today, given the complexity of the business you are in, you are addressing so many different personas and adjusting digital to that persona, which I think definitely some other industries can learn.
It's the same thing in banking, right? We saw this in the banking industry a while ago. It was like we all got our paycheck, by hand. We took it to the bank. We cashed it. We took our check, our cash back. Then we had drive-throughs. Woo, that was a big thing. Then we had ATMs. Then we could do it all on our phone. And it was online banking. Ooh, we were so excited. We had online banking, right? And then you know what? Now that's just how we bank. And there are some people that still go to the bank. And that's okay. And there are some people that like the drive-through because it's convenient. And there are some people that never carry cash and everything's in their iPhone, right? And all of that's okay. That's just how the world banks. And I think we'll see between telehealth and virtual visits and asynchronous visits that are done by text or looking for a doctor this way or that way, or we call or we don't call, or we answer the text or not. That's just how we're going to do health going forward. It's not going to be digital health anymore. It'll just be health.
Crystal, then tell me, healthcare is generally not the leader in innovation, correct? Especially digital innovation. You've laid a very strong foundation. I know I say foundation because I know you have a lot of big plans. You want to continue to do that. So when a lot of other of your peers, from the industry, from other hospital systems, call you, what is that first piece of advice you give them to be successful?
Find a small project where you find a pain point. Looking for I want to do AI, and so I'm going to bring in the biggest AI, whatever. That's not the way to go about it. Is there a bottleneck? Where is there a problem? We're attacking, no-shows. We realize that our GI suite is having 30% no-shows, the late cancels. So day before, all of a sudden people are canceling. What can we do to solve that problem? Well, people schedule 6 months in advance for a colonoscopy or whatever. So do they forget? How do we stay in touch with them and stay sticky so they know? So we came up with a plan where we would contact them 4 weeks, 2 weeks, 1 week, 1 day, so that the patient felt like they were being carried through the entire process all the way through. And if they weren't answering those text messages, we have a dashboard for the upcoming appointments, and we could see, well, Crystal answered, week 1, week 2, and then she didn't answer week 3. Maybe we need to reach out, or she's not answering at all, so we need to do a call instead, so that we're matching patients and things where they are. Finding that pain point and trying a new technology, as a pilot, just one area, one small department, we were able to see that the no-show rates and the late cancels went down by quite a bit. They maybe canceled earlier, and that's okay. It's okay that they cancel, but now we're not sitting with an empty operating room and a doctor that doesn't have something to do the day of. Instead, we can move someone else into that slot. So that's also helping access of care because we're moving slots up otherwise. So start small, find a place that has a pain point, and then when you do that, figure out how you can use that tool to propagate to other areas to make a bigger impact.
And then you talked about pilots. So recently, a McKinsey report created a lot of shares on LinkedIn. 80% of the pilots, are failing. What has been your experience in terms of the number of pilots you have launched, number one, and the percentage of success? And what differentiates a successful pilot versus a not so successful pilot? Because I don't want to call a pilot failing, because that's why it's called a pilot. Some will fail.
You want to fail, right? You want to try something and realize is this going to work? Is this not going to work? But I think if you go in and go, well, this is just going to be a pilot, so we don't have to do everything perfectly. Just we're going to try it and then see how it works. That never works. In healthcare, if you don't connect to the EHR, it's probably not a valid pilot. And it is very labor intensive on a digital team, on the vendor, on our IT staff to make that pilot happen. So if you're going to go through all that connection, you better have planned it out as if it was a full-blown plan. And that means your pilot has all the change management, all the communication plans. Everyone understands from the beginning what the end goal is. But not only that, you have to capture all of the data ahead of time. What are we trying? And we're trying to do no-shows. We're trying to stop late cancels. We're trying to get more people to register up front. So what percentage of people are registering today? And then when we put in the pilot for a very small 4 offices or 4 phone lines or whatever we're trying to attack, are we seeing a movement? If not, should we stop the pilot, or should we go back and tweak the software till we get a solution that we want? And then when we get there, do we add on, because you have your most viable potential first, but then there's lots of other bells and whistles you want to add on to a product, right? So do you wait and make it absolutely perfect and spend a year or 2 building that and then rolling it out? Or do you roll out something that can change a little bit and make a little bit of a difference, knowing then as you add more offices, you add more something else, you can also add more functionality? When I talk about pre-registration, we just did confirm and cancel at first. Just, hey, you got an appointment, confirm or cancel. Then we added on scanning your insurance card and driver's license. Then we added on copays. And as we were doing that, we were also adding on more offices and more offices. But we had a plan all the way through. And we knew by the time after the first 4, this is the notices that we send out. This is the training that we do. This is, all of the things along the way to make sure that it was successful as we continue to roll it out.
So in a nutshell, run pilot like a full production project with that intent, with that preparation, with that team and the resources committed, so that you really know, if it's a fit or not. And how important is the participation of the chosen partner?
First of all, that you can have a decent relationship with them. Because you're going to spend a lot of time with them. So you better be able to have a conversation with them and, have them understand where you're coming from, understand where they're coming from, understand what they can do, but also what they can't do. And if a partner won't tell you that, oh yeah, that's not quite baked yet, or, oh, we're still working on that, but we'd love to work on it with you, I'd rather hear that than, oh yeah, we can do it. And then you bring them in and you're like, well, you can't do any of this. Why didn't you tell me that at the beginning? Because it's going to fail. I was on a project once where we were almost ready to implement, and then not at any of the last couple. But then we found out that the software that we picked could not handle the load of data we were bringing into it. This was in an insurance company, not in a health.
I've been through that.
And then it's like, okay, well, go back to the manufacturer and find out when. They never plan on handling millions of records. It's not going to happen. So then we had to kill the pilot, kill everything that we were doing. Go back, start again, try to find another solution. It's very messy. So you got to know up front, and you got to ask the question. You have to know that, you both agree on the level of support, that they're actually going to be there if something breaks, that they're going to, help you along the way, that they'll really be part of your team. Would they mind have your people having their people's phones on speed dial on their cell phone so they can call if they need to? Because you know what? Every single vendor that we've had here, my team has all the cell phone numbers, because it's like having another teammate. You're looking not for a vendor that's going to sell you something and walk away. It's not like you're buying a couch. It's you're in it for the long haul, and you're going to continue to do it better. And they're going to bring new software ideas or whatever to the table. That stuff's changing so fast. Of course, stuff's going to change. And you've got to look for someone who's like on the edge with lots of cool stuff, but yet has a really solid foundation so you can get the work done now, but see the future of, and then they're going to go here and I want to be on that train with them.
And then talking about cool stuff, in your recent, I think the report you publish, annually, on the accomplishments of the university, I saw AI agents. Talk to us about your experience and success with AI agents. What do you think is the maturity level, and how are you participating in that maturity?
We have done a bunch of what we call flow jams, where we bring in clinicians or other frontline people to learn the AI agent technology and then actually create a workflow that would solve a problem for them. So we've done 2-day ones. We've taught our entire senior staff how it works so they understand the concept. And we have a big fellowship program. We had all 30 of our fellows go through it so that they could see what technology could do for the hospital systems. I'd say it's there. It's probably maybe 6 months before the technology is good enough for us to have citizen builders that can make their own workflows, but it's coming. And so for all the things where we are not efficient, nobody knows the problems better than the people who are actually doing them. So your frontline people, your desk people, your revenue cycle people know. This takes a long time. But if then they can go, okay, well, now I'm going to go to a class, I'm going to learn this, I'm going to be able to build it, or build it halfway. Like, I know that I want my workflow to be this. I'm going to create an agent that does this, and then I can't do this. Then I can come to the digital team and go, can you help me pull records that are this? Can you help me find the thing that scrapes the chart so I can find if somebody needs colonoscopy or not? Can you go back and get, health information exchange data or whatever to pull back and be able to tell? That's where the field is going, so that we can actually build stuff faster than IT, faster than the digital team. I can actually solve problems for myself with help, but we're going to be able to master that in the next couple of years. Everyone's going to make their own agent.
And I think you raise an important point, and I've which I want our viewers also to understand about training people and training your team on what is the potential of AI, what are the different tools available so that they can do it themselves. And that's very important across any organization, any industry. in terms of educating and upskilling the workforce?
It was crazy. We also did an exchange program. We brought some clinicians out to our partner, and they spent a week, and then they did. It's a project process where you have to pull out all the documentation that you need in order to get a clinical trial started. This can take days and days of work. They fed it into their workflow, and it was done in minutes instead of days. When they finally saw it run, the one girl started crying because it was just so impactful. We did one with the fellows where we had them call. And so the flow called to ask about an appointment or take in a medical intake or whatever. So they could start to see it. Well, all of a sudden in the classroom, phones are ringing and they're answering and they're talking to an AI agent. And then they're talking to the agent trying to, mess it up and see what it says. Like, can I order pizza or can I, what does it answer? Stuff like that. That was also a good learning thing because then they could see exactly how it answered. Then, some of our students were like, okay, well, let me talk to it as if I'm a Southern Belle. Do you understand what I'm saying here? I'm looking for a dog, whatever, and just trying to see if it could understand or whatever. So that was fabulous. So just to see the excitement of they get it then, and then they want to try something else. We have a waiting list. We can't wait because there's people that really want to start using it and learning it, and the tool's not quite ready for prime time yet.
That's great. So as we move towards the last section of our podcast, what excites you most about the healthcare AI, and where it's headed?
I really do think this agent thing is going to be something that's going to be fantastic for healthcare going forward. I think you're going to see it in a lot of other businesses too. I think more and more platforms will provide AI agents, technology somewhere where you can build your own, you can make it your own. It can be much more self-serve. And I think we're going to see a big change on how people work because everyone has their own little assistant on the side that can do something for them instead of the way we work today.
What are your personal, top 3 AI apps you use today?
I'm a big ChatGPT person. I'm on ChatGPT every day, all the time. And then I'm on my vendor apps more than anything else. So, but yeah, I'm literally dinner parties, everything, review this resume, do this, help me write a speech, whatever, I use it for all kinds of things. So how about you? What do you use?
I use, almost all of them today. So I use ChatGPT the most. Okay. And then Perplexity, more, for real-time research.
Mm-hmm.
I've recently started using Grok, just to feel the difference. And I think it's more about ChatGPT is the key, but it's more about really seeing how each model is different. What is it good at? I would say aggregator apps, where in the back end they'll use whichever model makes sense.
I want to make a movie. You'll just go to one place. It'll be your assistant. And then the assistant will go, oh, you want to make a movie? We'll call this one. We want to talk this. You want a voice one? It's going to be this one's the best. It'll just happen. Yeah, I agree with you.
So with all the AI, and everything, for all the young students, or people who are entering the workforce, what's the next job in healthcare that doesn't exist today, but you think it will?
I think it's going to be some sort of coach that helps people learn how to work with AI as if it's another member on your team. So AI coach, AI trainer, maybe. Because, like programs, we turn it on, it's done. You turn on a light, it's done. You implement something, you think it's done. Well, with AI, you're never done, right? And it takes a different skill set to know, because I might be a frontline worker, but I might now have an AI co-pilot. So that's literally almost an employee that I have to manage, and I have to know how to manage that tool, which is different than, some other things that I'm doing. Or I have to manage my AI, even though I have a staff of 8, and also know how they're doing it. So I have to make sure I have all that coaching and ability to do that and understand how to do it safely and understand what that means. And just like any employee, you need to give it a review annually, right? To make sure that doesn't have bias, that it's still secure, that it's still safe, that it's still doing at the level that you expected a year ago. Or do you need to change something, or something might be better?
Crystal, that was great. Thank you for sharing your valuable insights with us. Any last message, for all the CX and the digital leaders, which you would want to leave us with?
Just say, try to get started. If you guys haven't started on this journey, get started. There's a lot of people that are willing to chat with you. I found many people, because we're all trying to learn the same thing. Nobody's perfect at it yet. So reach out over LinkedIn, reach out over other things so that you can learn more and start to grow in the area. And good luck.
Thank you, Crystal. And viewers, you can always watch CEX Talks, where we get leaders like Crystal to share their stories and learn more, and then reach out to them. We will drop, her LinkedIn profile in the comment section. feel free to reach out to her in case you need any more insights and advice. Thank you for joining us.
Thank you.